take? If you want to take Monday, you take back, give back. Okay. If you want to leave,
madam will not come. Monday only madam will come.
Your bench. It is hanging, not.
Good afternoon all. Welcome to our national webinar series, a national webinar on role of sodium in physiological function and therapeutic on behalf of Homeopathic College and now I welcome our first speaker, Dr. for speaking on physiological aspect of sodium and its function on physiology.
Good afternoon all. Welcome to the national webinar on physiology, which is conducted by Anapoya Homeopathic Medical College and Hospital and Anapoya deemed to be University. I welcome all the participants for this session. Session 1, role of sodium in physiological function. Myself, Dr. Vincent George, Professor and Head of the Department of Physiology, Anapoya Homeopathic Medical College. Here we start. Role of sodium in physiological function, which have a role in different systems throughout the body, mainly in the basic structure cell. It have a very vital role by means of transport, and in the renal system by means of fluid balance, and in cardiovascular system by means of regulating the blood pressure, and in nervous system by means of action potential. Further we'll see each and every one separately. First one, in the basic structure cell, our body is functioning by means of homeostasis and maintaining the equilibrium, which is achieved by exchange of ions. These ions exchange will happen at each and every activity which is happening in the human body. body is made up of body fluid. Mainly intracellular fluid and extracellular fluids are there. The exchange of ions across these fluid compartments play a vital role in functioning of the human body. One of the main function is sodium. By means of sodium and potassium pump, you can able to see in the animation, this particular transport is an active transport which is happening between the intracellular fluid and extracellular fluid. Normally, sodium is present inside the cell. Normally, potassium is present outside the cell. There is a maintenance of equilibrium by exchange of these ions. Mainly, sodium, 3 sodium will be moving from inside cell to outside cell. It is an active transport which require energy that is given by ATP. The same mechanism happening at different places of the human body. Even a cell, even a tissue, even an organ also. Each and every step this will be happening. Next one is its a role in the renal physiology. Sodium is a major component which is actively reabsorbed throughout the nephrons, which is required for the body function. See, sodium is reabsorbed in renal tubules by different mechanism. As I told you earlier, it is an active transport, so it requires energy always. Followed by that, it can absorb by different modes. That means co-transport or counter-transport. For example, if it is a co-transport means sodium always move along with the chloride. So, co-transport of sodium along with chloride will happens mainly in the renal tubules, throughout the renal tubules of the nephron. Then, counter-transport. What I showed you earlier, sodium and potassium exchange. Few sodium ion, mainly 3 sodium ion will move out of the cell. At the same time, 2 potassium ion will enter into the cell. Like that, it will happen. That is a counter transport. Give and take policy, like that. Then, in cardiovascular system, sodium plays the major role in regulation of the blood pressure. This is commonly known to all. Normally, for hypertensive patient, will restrict the sodium intake. The reason is it will increase the blood pressure. Similarly, those are on dehydration, okay, where there is a fluid loss. Especially, you can take an athletes during their interval time, they will be given salt and lime in order to dehydrate their body along with fluids for rehydration. Okay, again, sodium has a major role for rehydration. During the regulation of blood pressure, along with heart, kidney also have a major role. That is achieved by the mechanism, renin-angiotensin mechanism. See, if in a case where there is a body fluid is lost, it may be due to hemorrhage or it may be loss of fluids. Okay, for example, diarrhea or vomiting, which are the most common reason which will lead to dehydration. So if it happens at the time, kidney will secrete the angiotensinogen so that angiotensin secreted from the liver and renin secreted from the kidney. So angiotensinogen is converted into angiotensin 1 by the action of renin, which is a hormone secreted from the kidney. Then angiotensin 1 is converted into 2 by means of angiotensin converting enzyme, which is secreted from the lungs. Followed by that, angiotensin 2 converted into 3 and 4, so that the final outcome will be the secretion of aldosterone from the adrenal, which will lead to reabsorption of sodium and water from the renal tubules. At the same time, widespread vasoconstriction will happen, which will boost the reduced blood pressure. This is the one mechanism, very important mechanism of the kidney, which will increases the blood pressure. Followed by in the nervous system. Again, the first mechanism which I explained you by means of across the cell membrane, how the exchange of ions are happening. In nervous system, mainly by means of action potential. Consider here you are applying a stimulus so that the resting membrane potential of the muscle and the nerve get disturbed, so that it has to show the response. That response is usually showed by means of depolarization, which is followed by repolarization. This upstroke and downstroke is done by means of exchange of ions. If you note that diagram exactly, over there it is explained that resting membrane will be altered so that sodium will be entering into the cell, followed by potassium ion, which will move out of the cell in order to maintain the resting membrane potential again back. So it will go for hyperpolarization, which is below the resting membrane potential. Again it will come back to the normal resting membrane potential. In general, always resting membrane potential has to be achieved. Applied a stimulus, you will get a sequence of event, depolarization, repolarization. During that time, exchange of ions will happen. See, this upstroke is gradually it increases, because initially few sodium ions will open, followed by that, because of the affinity, more and more further sodium ions will open. So it will reach the peak, that is a spike potential, followed by that repolarization, that is a potassium ion will start moving on the opposite direction of the sodium. By this mechanism, it is mainly happening in the neuromuscular junction and muscle conduction. These are some of the major role of sodium in the human body. Further, it is continued by the guest speaker.
A warm good afternoon to all. It's a great honor for and pleasure for me to introduce our speaker today, Dr. K. Maniganda Perumal, a homeopathic consultant having more than 13 years of clinical experience and 9 years of academic practice. He is working as a professor and head of the Department of Materia Medica, White Memorial Homeopathic Medical College, Kanyakumari, and chief consultant at Shanti Krishna Homeopathic Clinic, Nagarkovil. He is graduated from Sharada Krishna Homeopathic Medical College, Kanyakumari, and pursued his post-graduation with gold medal, first rank from Vinayaka Missions University, Salem. He has completed his master's in counseling and psychology as well. And he is the first person to register PhD in the Department of Materia Medica in Tamil Nadu, Dr. MGR University, Chennai. Adding to his academic excellences, he is a well-known homeopathic psychiatrist, a well-known clinical psychologist, trainer in basic life support and CPR, eminent trainer in personality enhancement programs, and he has won the prize in interstate homeopathic quiz competition during his student life and later been the quiz master of various national level quiz competitions. And he has presented and published various papers in national and international seminars and journals. A few among them are a case of angioedema in pregnancy and its homeopathic management, a case of surgery compromised by sweet pills, is there medicines in homeopathy, psychiatry and psychosis, a case of pneumatocyl and its homeopathic management, a case of schizophrenia and its homeopathic management. Today, Sir is here to share a refreshing, energetic perspectives on role of sodium in physiological function and therapeutic indications of natrium group. Warm welcome and all the very best to you, sir.
So thank you, Tom. That was so grateful hearing good words from Dr. Tom. And let's start the session. First slide. So thank you for introducing me and also to educate regarding the role of sodium in physiological function by Dr. Windsor. So here I'm going to sum up what Dr. Windsor said in the previous presentation. And my intention is here to understand natrium in terms of its physiological function. So most of the topic, the basic physiology has been covered by the previous session. So I will be skipping certain slides which I prepared earlier regarding time consumption. I'm saying this. So next slide. So history of sodium. The name sodium probably originated from an Arabic word suda, which means headache. It is well known that when we hear natrium group, though it is a natrium group, we will be always thinking and relating it with the natrium mure. If you are a practitioner, you won't say no. I know that because the natrium mure is a drug which is well known for its headache, and it is no surprise in the history this particular natrium, the word itself has been derived from headache, that is an Arabic word. The word soda carried to Latin as sodanum, it means headache remedy, and the soda used as a cure for headaches among early peoples are well documented in the history. So the sodium has an impact of headache, that is an unquestioned pattern which is practiced in the previous eras. Next slide. So let's look back to our +2 standards, the periodic table. We won't be forgetting that very easily. And as you all know, sodium belongs to the first group that we call as alkali metal. Surprisingly, the first years I'm not very sure, but for the practitioners and also for the third year, final years and all, we all will be well versed with sodium and natrium mure. But we have been taught in our classes that phosphorus is considered to be an atmospheric barometer which reacts extremely to the change of weather. But not surprisingly, sodium is also equally reactive to the atmosphere. So in terms of sodium, if you see, it will be white silvery like pattern in its crystalline form, and we can't even pull sodium outside. I can say it in another word, sodium can't be seen alone in the earth crust, though it occupies the 2.8% of the entire earth crust, but it can't be seen as an alone. So it will be seen with other elements in terms of its reactive power. Okay, so if you draw the valency circle, it will be mentioned as +1 cation. That means it is ready to lose an ion. So it is highly stable, highly reactive. What happens if you want to store sodium also, you have to store sodium inside an oil. If it is pulled out of the oil, what happens? It will react with the moisture content which is present in the atmosphere, and it will start to burn. Even if you put in water, it reacts with water and it gets converted into sodium hydroxide or sodium hydride, and it burns with the yellow flame. Okay, a lot of videos are available. I don't know whether we are able to play that. Anyhow, if possible, at the end of session, I can show you what happens when sodium is immersed in water. Next slide. So sodium is the major element of extracellular fluid, that is of no doubt. Dr. Windsor mentioned about those things, so I am skipping that. And one interesting factor is in an adult, previous slide. In an adult, 92 grams half of which 46 gram is located in the extracellular fluid. It is well known that the actual physiology states that sodium is inside the cell, and but what happens, the exact 50% of the sodium which is present in an adult male is in the extracellular fluid at a concentration of 135 to 145 millimoles per liter. There is a surprisingly an unknown factor again. Whatever might be the condition, the body will try to maintain the levels of sodium in the body. Though the person might be having some nephritic, whatever might be the condition, this will be maintained. Even his ingestion is not maintained or the excretion of sodium is accelerated, this level should be maintained. Otherwise, it is going to cause some serious issues. As the previous session conveyed to us regarding the acid-base balance, the water balance, the resting potential, depolarizations, regarding the maintenance of ECF and ICF pressure. Not only ECF and ICF, but also even the glaucoma, the acoustic pressure, vitreous humor, everything, sodium is playing a major role. So that sodium is, we can't imagine what happens when the sodium level, that means the hyponatremia, results into it. Next slide. The biochemical functions of sodium, okay, summarizes the muscle irritability, osmotic pressure maintenance, acid-base maintenance, intestinal absorption. Dr. Windsor mentioned about the active transport, so that the sodium is there in the every channels. The gate channels has been monitored by sodium, so sodium has to let these things into it. Okay, then initiating and maintaining the heartbeat. That means it acts on the nodes, that also is well evident. Next slide. Sodium excretion is precisely matched to intake under steady and state conditions that I already mentioned. Next slide. So action potential, okay, the resting membrane potential of cells varies depending on the cell type. The resting potential for neurons typically sits between -50 to -75 MV. So what happens? These voltage gated sodium channels play an essential role in the initiation and also for the propagation of action potentials in neurons and other electrically excitable cells such as monocytes or endocrine cells. So not only regarding a specific organ like thyroid or neuron, whatever might be the condition, the active transport has to be taken care of these sodium channels. Okay, next slide. The action potential in cardiac muscle is well maintained by sodium in forms of two. The fast one is sodium channel, and always we know the regarding the calcium channels. When we call back our pathology classes, we'll be well versed with that calcium metaphysis. That means the dystrophic calcification and dystrophic calcification. So what happens when we have excess of calcium? It happens and develops to a metastatic calcification in a diseased conditions. If the body tissue is no more, it is not functioning, there we will be getting dystrophic calcification. But what happens? These calcium influx that we call as calcium influx, those are very slow when compared to sodium channels, but both have action for the action potential in the cardiac muscle. So we can remember it as the sodium as the fast sodium channel and the calcium as the slow calcium channel. It has a lot of things to be correlated with materia medica. When we remember natramure, we can't neglect the point, the palpitation. Even the palpitation of the heart is better felt on the face. And also even we have the person is so agitated. So all these things, because the sodium in its nature also, I already mentioned, it is highly reactive. So it will be what is the fluttering of heart that is felt. The very symptom mentioned in our Allen's key could be related with the fast sodium channels, the action potential in cardiac muscle. Next slide, please. So sodium in blood pressure, I think it was very clearly with a lot of diagrams Dr. Windsor mentioned. Next slide. So cerebrospinal fluid secretion. So when we come to CSF fluid, what happens? The secretion of choroid plexus. We all know that CSF are being secreted from choroid plexus depend on active transport of sodium ions through the epithelial cells. So whatever might be the epithelial cells, there will be these sodium channels. So even natramure, if you relate, we can many others we are going to see in the future slides. They will be having some diverse opinion where most of them brand these natrum groups as extremely dry, and certain people will be talking about the copious secretion. That is the beauty of homeopathy, I suppose. How we study bryonia for the both thirstless and also thirsty remedy in 3 marks, like that. So not only the blood pressure sodium is maintaining, but also it maintains the CSF pressure. So you all might be knowing about the CSF pressure, and it is being regulated by, okay, only that point I want to highlight. It is an example, not only CSF, whatever might be, even I already mentioned, even the aqueous humor or vitreous humor, whatever might be, it has a role in regulating CSF. So why I mentioned CSF alone, that you will be thinking about it. I could not separate natramure, natrum group and headache. So a lot of headaches are going unexplained. So this could be of a major important role, which we can't neglect when we treat headaches. The intracranial space occupying lesions, that has to be considered along with the common migraines or any traumatic reasons or a referred headache or a cluster headache. Okay, so this should be kept in mind when treating a natramure. Okay, next slide. Okay, coming to thyroid. Okay, this I shall explain, I think, because this has not been mentioned in the previous session. So what happens, why sodium is so important in thyroid function means, I had mentioned in the right corner that sodium iodine symporter. You could see that sodium iodine symporter. So in the ECF, sodium is abundantly available in the blood. So along with every 2 sodium influx, there will be one iodide trapping will be done by the follicular and parafollicular cells of thyroid. So that this iodide trapping is possible only with the availability of sodium. And we could not neglect again natramure. We give this remedy not only for hyperthyroidism but also for hypothyroidism. So for both hyper or hypo, we use natramure. And how it plays the vital role means, it is getting along the co-transport of the sodium and iodine with the inside the, by means of the active potential inside the follicular cells. Okay, so next slide. So natramure is a remedy to, not only natramure, the natrum group of remedies to be considered for a thyroid, a goiter, whatever it might be the goiter, it because of physiological or in terms of secretion hyper or hypo, or in terms of growth regarding a neoplasm or a malignant or a benign one, or it is a Hashimoto's like an autoimmune, we can utilize natrum group of remedies in the treatment of goiter. Coming to the role of sodium in olfaction, again it is an example alone in terms of physiology. The cyclic adenosine monophosphate activates the membrane protein gated sodium ion channel to pour through the membrane into the receptor cell cytoplasm. So what happens? The sodium ions increases the electrical potential in the positive direction inside the cell membrane, thus exciting the olfactory neuron and transmitting action. So regarding the sympathetic and the parasympathetic nerve supply, the afferent and the efferent sensations or these messages has been conveyed. If it has to be conveyed, the sodium channels plays a vital role. So not only in terms of olfaction, all the special senses, sodium plays a vital role. So sodium, we could not keep it separate entity. Though in the earth crust, I already mentioned, sodium can't be can't remain in an idle position. In our body, sodium is that inevitable element. Next slide. So natrum group medicines, again, it is going to be a great exercise, I suppose. List of 73 remedies I had compiled. I am not very sure. I don't really, I don't want to mention the total remedies as 73 in the next slides and all. But this is an ever, what do you say, growing group. So a lot of remedies has been newly proven, and it has been tested, proved, verified, and confirmed, and it has been sent to HPI very recently. So to start with borax, the natrum aceticum, natrum acetalosulfuricum, natrum arsenicosum, benzoicum, biborazium, borazium, bicarbonicum, bisulfurism, boricum, like that the list goes on. Next slide. So I will be highlighting, I'm skipping the slide now because for the time factor, we have a lot of cases to be discussed. And I will be highlighting the importance of these drugs then and there where the therapeutics comes. Okay, next slide. So coming to the homeopathic aspect, Dr. James Tyler Kent, he has a great view on natramur. If you go through the lectures on homeopathic philosophy, it is well evident. He talks about the individual who grows so thin with the symptoms of salt. He is taking salt in great quantities, but not digestible. There is starving for salt. There is natrum inanition. So inanition, what does inanition means? The person will be growing so weak, irrespective of the uh, lacking of the particular element that we call as inanition. And here he highlights the natrum inanition. The salt will be found in stool, for it does not enter into the life. So it does not mean that salt is present in the stool. Here the context is the person eats salt, but the person, those who are not able to absorb the salt or to utilize the salt or to use the physiological utility of the salt, and those who develop debility because of that, because it is clearly mentioned that sodium and water is going to do co-transport. So in the common practice also, we will be saying about if we eat salt, we have to drink water because it pulls the water along with it. Sodium and water co-transport. If you see in the distal convoluted tubules of nephrons, it is well evident. So that what happens here, this fellow eats salt, but it is not going to change any change in his body. Then we do not, with our small dose, supply the salt that the system needs, but we cure the internal disease. We turn into order the internal physical man, and then the tissues get salt enough from the food. What he tries to mention here is the person, we will be getting patients like who is coming of debility, hyponatremia, metabolic encephalopathy. Such conditions, natramur or the natrum group remedies will be a wonderful boon for those individuals to get treated. Next slide. So here, something contrary, as I earlier mentioned, William Borik's view, the prolonged taking of excessive salts. Here he talks about the abuse of sodium chloride. The prolonged taking of excessive salt causes profound nutritive changes to take place in the system, and there arise not only the symptoms of salt retention as evident by dropsies and edemas, but also an alteration in the blood causing a condition of anemia and leukocytosis. These are the very words expressed by William Boring, because I want to highlight how these pioneers are relating natrum group in our therapeutics. So here he talks about the excessive salt which takes away the nutrition of the person. Okay, next slide. But here the same person, previous slide, the William Boric, again he talks about the excess salt, but what happens, he consider natrum group of remedies for Addison's disease. In his therapeutics, he clearly mentioned it is a remedy for, great remedy for Addison's disease. So it is a contrary to his statement, yet it is the beauty of homeopathy, where it shall be considered for both the hyponatremia or the person consumes salt, but he is not able to utilize the utility of salt. Then also we can use these natrum group of remedies. Next slide. So Clark's view, the action of the sodium sulfate is contrary to that of sodium chloride. Both indeed have the faculty of attracting water, but the end is a contrary one. So here I'm going to talk about the transudate and exudate. What happens here? Natramur, more of a transudate variety, and where natrum self along remedies like calcarea self and all, we will be constantly thinking for some pus formation. A psychotic person who develops a non-healing or a pus forming, a suppurative, so such conditions. So natrum self is a great psychotic remedy, is again a psoric remedy, again a syphilitic remedy, yet it is an remedy for conditions like boils, carbuncles, and for staphylococcal infections and all. For where the pus turns into the greenish, yellow, golden like our pulsatilla, we will be thinking of natrum self. So what happens here? The sodium, the water gets trapped along with the sodium like a transudate. We think of natramur. So here the group remedies are getting their shapes or getting their exact colors. So what happens with the natrum self? It is for a remedy which is commonly indicated for a exudation. That means the water which contains the active elements, the organisms, tissue debris, along with the inflammatory cells. Such conditions we can think about natrum sulf. Next slide. So NASH on natrum group. So you all will be well known about the leaders on homeopathic therapeutics. So here, there, he talks a lot of natrum regarding the dryness. He quotes the word dryness there, then and there. I will be following his words. It enters into the every tissue of the body, even into the enamel of the teeth. There will be sodium. That is the word used by him. Speaking now physiologically, it is regarded as a stimulant to the various tissues into which it enters. It exists in quite considerable quantities in the various humors of the eye. So just to you imagine all these things, aqueous humor, vitreous humor, all these things has been, the presence of sodium has been well elaborated in our Pioneer's textbook itself. So particularly in the aqueous humor and crystalline lens, and also in the vitreous humor, it has been said that its function here is to preserve the transparency of the respective tissue. So he highlights the essentiality of the fluid content or the pressure content inside the aqueous humor and the vitreous humor, and he also talks about the conditions which are developing because of the pressure variance in terms of the ECF and ICF. We can utilize the natrum group remedies. Next slide. Chusler on natrum group. We all know in the tissue remedies of Chusler, there are 3 salts have been included from natrum group. So he believes that the salt has a function which can lead to catara. I already mentioned the sodium and water co-transport. So when and wherever there is an epithelium, there will be a copious secretion. So epithelium will be holding a mucous cells, and where the sodium is getting acted and the active potential is being created, it shall be a remedy to be considered for a catarrhal discharge along with the other psychotic remedies. So wherever you find a catarrh with a copious secretion of clear normal mucus, there natramur can come in as a remedy. So we are well versed with natramur regarding that allergic rhinitis, which occurs especially during certain seasons, periodical remissions, or an acrid nature which is felt in the eyes, and as if worm is squirming inside the nostrils. Such symptomatology, if we get, never fail to remember natramur. It is an excellent remedy for an allergic rhinitis. Whether it is an acute thing, we can even repeat natramur to the extent. Next slide. Okay, so you will be thinking how to relate. So the point is, here the physiology, the studying the sodium in terms of physiology helps us to remember the materia medica. Materia medica is the topic which is the easiest one and the most confusing one. When we study natramur, we are well versed with natramur. When we start natrum carb, we will forget natramur. So that is the blessing of us. So our we shall remember certain beautiful, uncommon, rare, peculiar symptoms, but not all the symptoms. But by relating in terms of this particular drug, in terms of its physiological action, everyone can relate and identify when and where the natrum group remedies is to be prescribed. So for that purpose, I had summarized all those things. And now we shall move into certain therapeutic indications of natrum group. So first slide. So the mind of natrum group, most of us will be knowing it, the hysterical condition of the mind and body, the hysteria. So hysteria itself is a misnomer word. Some of you might be knowing it is now replaced with the word called as conversion disorder. Not convulsion, it is conversion. So that hystro means uterus, and the word itself mentions that it is well prevalent among females. So these type of hysterical conditions, those who crave attention, have a weeping alternating with laughing, irresistible laughing at unsuitable times, prolonged spasmodic laughter. This will be followed by tearfulness, great sadness, joylessness. I'll be continuing with these symptoms, but we will have a discussion of this when I come to a case. Okay, no matter how cheering the circumstance. Okay, next slide. She is benumbed to impression, easily takes on grief. So what happens when we enter into a hotel, we will be seeing a lot of tables, and we'll be said that we are not allowed to sit on the table. We asked why, then they will be replying, sorry sir, this table is been reserved for by some other person. So reservation, we understood reservation like that. What happens in natramur? Natramur is a remedy for reserved displeasure without cause. There will be cause, then there is grief, that is normal. But even without a cause, or the cause is not sufficient to label it as a grief, will bring on a lot of displeasure to these natramur individuals. So those benumb to impression because of his anhedonic nature, that easily takes on grief, grieves over nothing. With no reason, the person will be sad. Unpleasant occurrences or recalled that she may grieve over them. So the very word which is used by Dr. Javaharsha, there are a lot of 100 items to be happy, to remember and to recall those things and to remain happy. But these fellows will recall some 5 unwanted things or the things to be forgotten, and they will brood over those things. So that there will be a lot of benumb to impressions. They are not moved with impressions. If something is happening, they are not moving up with the consolation, aggravation, the state of mind, the melancholy, the tearfulness sometimes brings on anger. So it is well evident that consolation is going to aggravate natrum group remedies. There is no exemption in the natrum group or the entire 70 list. So these fellows will be having a thought that my grief I alone know, my pain I could alone feel. So nobody is capable of understanding myself, and I am alone going to suffer. And the psycho defense mechanism, most of the time they use repression. Okay, we will talk about repression when we come to the case. She appears to bid for sympathy and is mad when it is given. Okay, so when she is being looked into her, she seems that she requires a lot of care and affection. Somebody should console, but when we go near her, she will fire back to us. Okay, next slide. There is a great prostration of the mind, extreme tiredness, the person can't think anymore. There will be hypochondriasis. Hypochondriasis, you all will be knowing, there will be a lot of exaggerations, is directly associated with the indigestion in natrum card, and in natrum mur, hypochondriasis is associated with the constipation and indigestion. So this is how the natrum group varies all along. So the purpose of studying natrum group itself is to sum up certain symptoms or presentations or disease conditions and to relate with the natrum group. And all along the natrum group, if you see, each remedy is definite. So at the end of this seminar, I want to highlight one thing that I am intervening here. You might be studying the natrum group, but at the end of this seminar, we are not going to prescribe the natrum group. We are going to prescribe a single remedy. So the group gives us a lot of things to get remembered, materia medica. But the knowledge of and the symptomatology of the particular remedy alone will give you to the lead to the prescription. Next slide. So coming to the lectures on homeopathic materia medica by Dr. James Taylor Kent, she is unable to control her affections and falls in love with a married man. So we all will be knowing what is the remedy it is. She knows that it is foolish, but lies awake for love for him. She falls in love with a coachman. Okay, why all these things happen? That has to be answered. She is extremely forgetful, cannot cast up accounts, is unable to meditate, forgets what she was going to say, loses the thread of what she is hearing or reading. Unrequited affection brings on complaints. Next slide, I will explain those things with the case. Next slide. So case 1, please make a pardon that I am not following a strict analysis and analysis for any of my cases I am going to present today. If the fortune permits us, in later days, we shall have a detailed discussion of all these cases in terms of analysis and anamnesis and repertorial totality, everything we shall discuss, but not today. But why the context, the very context when I accepted this seminar was to highlight the physiological role of these sodium and to relate with materia medica. So in the case, I am trying to make you remember natrum group of remedies in terms of identifying a person inside the natrum. So the entire all cases will be in the narrative style, like our M.L. Davle's principle and practice of homeopathy. There will be a narration style. No, I had just mentioned in that order. So a 27-year-old female working as team lead in IT sector with irregular menses since 8 months before that periods are regular. Now the cycle is for 40 to 60 days and the bleeding is for 1 or 2 days. This started after an incident. She had a love affair since 3 years and got separated because of family problem. That is the ailment factor for this complaint. Next slide. So what happens here? The things which we learned earlier, all those things are summarized in this case. We can decode one by one. So there is a lot of ailments of disappointment, of a broken love and anxiety, the fear of future. The mind is so reserved and the menses is irregular. And all these things are considered and natramure was given for this case. Next slide. So case 2, this is a girl of 12-year-old presented to me with swellings in the neck since 2 years. She is away from her parents and taken care by grandmother since 3 years. She felt alone, abandoned, not mingled with others. She had headache on sun exposure and constipated. She was advised for thyroid function test because of her swelling in the neck. Next slide. So here the TSH I had circled, it is more than 100 milliunits per liter. And after treatment, the TSH came down to 2.75. Okay, all these things happened just in 5 or 6 months. Next slide. So this is the exact presentation of the girl when came to the clinic. So the laboratory investigation, both the lobes of the thyroid and isthmus are mildly enlarged in size with the mild loss of normal CT attenuation, and he suggested for Hashimoto's thyroiditis, and ANA profile has been done and confirmed. Next slide. So we can see the few doses of natrum, how the wonder took place in only 5 months. So this is how natrum is capable of. So again, I'm coming to this case. This is the case I mentioned. The girl is not living with her parents. She is living with her grandmother. The separation of the parents was the main core to be considered here. So we can just imagine how the girl suffers and her lives went through. He narrated a lot of story regarding that. I already promised that we will be having a later case discussion session in those time. Okay, just I wanted to show these slides. Next slide. So brooding, coming to brooding, the natrum car, the mental weakness and depression. Natrum mure, there will be sad weeping mood without cause. Natrum self, there will be melancholy. As we know, it is a remedy for suicidal tendency. So coming to depression, it's a very beautiful point to be remembered. If the person is at the peak of depression, he never commits suicide. This is not a simple word, it is a statistical evidence, because the depression will lead the person to the psychosomatic passivity. So the psychosomatic passivity don't allow the person for a suicidal action. But we should be very cautious when the person is improving from the depression, because when he regains that psychomotor activity, the person might commit suicide. So when and wherever we are treating a case, with natrum group or whatever might be a depression case, when you are treating, when the person is starting to give improvements, his psychomotor activity will be increasing, and the risk of committing suicide is more. So we should be very careful at that instance. That is to be recorded regarding brooding. Next slide. Next slide. So lacrimation, VP mood is common in natrum Rs, especially when the person complains of when I am going against wind, I am getting excess lacrimation. That is a symptom. It is not, the natrum Rs can't be given. Therapeutics, as you all know, that symptom suggests for natrum Rs. That's alone. Then natrum mure, burning and acrid tears with laughter, cough with lacrimation, the cough with lacrimation, and even not only lacrimation, there will be dribbling of urine while coughing, along with causticum, pulsatilla, squilla. You can remember natrum mure also. So the ladies, those who have underwent labor, who developed lax pelvic floor muscles, and are suffering with spurting of urine while coughing, we can think about the natrum group remedies. Next slide. Natrum stimulates cellular activity and increases oxidation. Next slide. Next slide. Okay, so natrum carb for the sunstroke. We never forget natrum carb. The person who is so debilitated by the heat, sun aggravates in all the form. All the complaints comes from with the sun. It peaks with the sun. It goes with the sun, like natramur also. But it is the chronic sunstroke. The person who is working at under the gaslight. All these fellows require natrum carb. Natrum hypochlorosum. Here, what does the beauty means? The person who is very flabby previously and later developing a lean debilitated constitution, we can think about hypochlorosum. The natrum mur, especially the emaciation is felt at the neck and the prominent clavicles. And natrum nitricum exhaustion must rest frequently when walking. So here, while walking, he has to give up walking in order to compensate his exhaustion. Next slide. So GIT, okay. Next slide. I'll explain this GIT in the next with the case. So this is a very beautiful case. Actually, it requires a lot of understanding. In the common practice, you will be heard about enema. So what is enema? The fluids are being injected into the rectum for a constipation. That is to promote the fluid inside the rectum and to palliate the constipation at that particular instant. And nowadays, allopathic people or the modern people are utilizing glycerin. They are introducing glycerin as the rectal suppositories. Okay, so what does it act? If you understand that, it causes a hyperosmolar laxative. It acts as a hyperosmotic laxative, so that it drags water from the ECF into the rectum, and by that it dilutes the stool and it eases the constipation. What happens here? A female aged 17 years came to my clinic with constipation since 2 years. She was on regular laxative since then. She was also taking enemas on and off. She was little timid. She asked, so this is how means the girl is not at all coming up. Initially, I thought that, okay, constipation is not that good condition like diabetes or hypertension. Sir, I'm having hypertension. Okay, that is a privilege like that. It has been termed as lifestyle disorder, but constipation, we are not easy to reveal that constipation. So I was thinking about it. I was getting little prejudiced at that moment, and later I identified and I asked that, okay, sir, I ungkitta in Tamil, she told certain things. I want to discuss certain things with you. So I asked, okay, well and good. Sir, could you please wait outside? Like that, I asked with the bystander, and he gone outside. Then only I came to know that the bystander who is associated with the patient is not a father, but is uncle. Because her father expired long back, and she was when she was a child, and he was taken care of. Next slide. And he was taken care of by the uncle's family. So this uncle family is so genuine. They are looking after her from the childhood. They are caring. They are giving all the financial support. Even they are making the girl to learn in an engineering college. But what happens? This girl's mother is being employed in her house as a labor. So she has to look after all the households. All the households she has to look after, and there will be a constant what do you say, blaming which has been received. But what happens? No, unfortunately, this girl is not able to express any of her emotions at that house, because the whole family is looking after them. So when her wife is getting her mother is getting insulted in front of other relatives, other family relatives, she is not able to express any of it, and she brooms. Here the psychoactive defensive mechanism which is used is repression. The repression is the clue of this case, and I had not mentioned the remedy here. Okay, so the repression is the clue of this case, where the active forgetting. So if she is able to repress only, she is able to push forward her days. And very few doses of natramur 0/3 and along with some thuja in higher potencies cured this girl in 4 months. And this case came to me some 5 years before, and now she is a very happy engineering employee in Bangalore. Okay, next slide. So just imagine how the few doses of natrum is capable of doing a life-changing miracles in patients. So this is regarding respiratory natrum Rs. We are nearing the time, I suppose. Okay, so the natrum Rs for minus asthma, natrum carb for the cough with coldness of left chest. We can think of natrum carb. The natrum sulf, we will be thinking of the left lower lobe, psychotic pneumonia, or babies those who are born to psychotic parents. We can think of natrum sulf. Then natrum mur, cough from tickling in pit of stomach with stitches in liver and involuntary urination, natrum iodatum for chronic bronchitis, and if it is a laryngeal phthisis or a hoarseness in singers, along with argentum nitricum, aurum triphyllum, never fail to think about a new remedy, natrum selenicum. I had tried this natrum selenicum in many of the cases where aurum triphyllum was not that useful. Natrum sulfocarbolicum is a remedy commonly given for all sort of pleuritis, ascites. When it is you suspect a purulent pleurisy, never fail to remember sulfocarbolicum. Likewise, natrum taurocolicum, it is a remedy given for acute pulmonary edema. Tellurium for nocturnal sweat of phthisis. Next slide. I am little bit hurry as we are nearing the time. So pediatric age group, borax, we all know the baby which clings around the mother, dread of downward motion, tangled hair, apathy, all these conditions, natrum Rs, bronchitis in children over 7 years, that is very marked clue to prescribe natrum Rs, bronchitis in children, those who are above the age of 7, natrum mur, irritable crying for slightest cause. I mentioned about that reserve displeasure. Then natrum phos, the babies which grinds the teeth in sleep, the for temper tantrums. Okay, I had not mentioned temper tantrums. You can make a note of out of it. For worms, colic with acidity, sour stool, incontinence, urine with acidity of stomach, excess lactic acid, overfeeding of milk and sugar, the natrum phos is the important remedy. Natrum sulf, as you all know, it's a remedy for asthma of children of psychotic parents, born to psychotic parents. Okay, case 4. Okay, I'm not going into the detail. Just I mentioned natrum sulf has been prescribed here for a 6-year-old child who suffered with episodes of dyspnea. Most of the time, the parents used to carry this girl to the nearby primary health center for getting some deriflin injections or nebulizations, and now she is very happy without any of these bronchodilators. Next slide. Periodicity, natramur is a remedy where the chill at 11 a.m. in malaria, periodical headache, neuralgia of ophthalmic branch at 7 a.m., natrum sulf, especially at 4 to 5 a.m. This is a very, very important point. When you get a 4 to 5 a.m. aggravation with severe cough or dyspnea like complaints, you will be remembering heparin sulf in the early morning, calicarb in the early morning, even arsenic album after midnight, like that you will be remembering. Don't never forget to remember natrum sulf. When the symptom calls for natrum sulf, it is the remedy and it shall cure the entire case. Next slide. So Gibson Miller's classification. Okay, hot, chili, ambi, all these things are mentioned. Ambi is natrum carb, hot is natrum mu, chili is natrum Rs. Next slide. Sensitive to sounds, natrum carb are oversensitive to hearing, natrum sulf or lively music makes her sad. Okay, this is a very valid point. Borax also very, very sensitive to the slightest. Next slide. But what is the beauty of borax? If you see, the slightest noise causes much aggravation, but the person does not bother the loud noise. That is the beauty of borax. That is to be remembered. In terms of sun aggravation, all the remedies have sun aggravation, but natrum carb, natrum mur, natrum selenicum, all these remedies. Next slide. Food and drinks, there is a constant aversion to milk. It is a remedy to be considered for lactose intolerance and for glutton-induced enteropathies. Natrum carb are the remedies which will hit like anything. The diarrhea from milk, lactose intolerance. It commonly we encounter these cases in pediatric age group individuals. Even for grown-ups, that glutton-induced enteropathy are being well reversed with natrum carb. Coming to natrum mur, it craves salt and there is a great aversion to bread. This is in terms of food and drinks cravings. Next slide. So aggravation, we all know music aggravates natrum mure, natrum sulf, natrum carb, and the summer aggravation is in terms of natrum carb and natrum mure. Mental exertion, most of the natrum group remedy is heat, and natrum coming to the natrum sulf, it is aggravated by damp weather. We all can recall the point. Aggravation for people, those who are living in basal damp cellars, when the weather contains moisture or water content in it, it aggravates like anything. And thunderstorm aggravation by means of natrum carb and natrum mure. Next slide, natrum phos. So tongue characteristics, we all know, we all have a Google tongue for natrum mure because of its affection and the ringworm affection of tongue. We can think of natrum mure along with the tarazacum. That is also a very important remedy. Then natrum hypochlorosum for furred and large flabby intended tongue. I have a, okay, I'm not naming, she's also a doctor who have these type of a furred and large flabby intended tongue. I'm having that picture. If possible, I will show that. And the natrum hypo, initially I gave natrum mure, then I tried with the tarazacum, but the exact remedy was natrum hypochlorosum. That is the remedy where she improved like anything, and still she is developing that complaint then and there. But we could not trigger any modality with her. Might be it will be encountered in the upcoming sessions. Natrum phos, there will be blister in the tip, yellow creamy coating of the tongue. The yellow creamy coating is the clue, the takeaway point for natrum phos. And the posterior portion of the roof of the mouth is also yellow coated. Next slide. So integumentary system means the study of all the skin, the exocrine glands, all these things. I already mentioned natrum have an extreme action where it can drag water along and causes excess copious mucus or moisture. And if you go through the keynotes of natrum mure, you will be getting points, sweating on the face while eating, all these complaints. And likewise, the natrum carb, if you see, there will be extreme dryness will be there. Okay, and natrum mure, the beauty of the eczema is it always occurs at the edges of the hair. That is the uncommon, rare, peculiar symptom of natrum mure. Most of the eruptions occurs at the edges of the borders of the hair. It might be of the scalp or the beard or the mustache, no issue, but there will be greasy skin along with borders. Natrum phos, it is given for lymphatic gland swellings, and natrum salicylicum for pemphigus, an autoimmune condition, and for urticaria, this salicylicum has an excellent action on skin. And for natrum sulf, we will be getting dermatographism. You will be knowing about dermatographism. So after bathing, or there will be a map-like appearance of occurring without a cause, or a minute slightest injury will lead to a development of such conditions. We call it as dermatographism, and natrum sulf is an excellent remedy. Moreover, it is a psychotic manifestation too, to be remembered. Next slide. So what's natrum mure on palms, natrum sulf like red lumps. Next slide. Okay, I think we are running out of time. Next slide. So, okay, I'm not going into the case, but this is the case. Just you can hear me. I'll be narrating it fast. Again, a broken love individual who came to me with the warts, which first occurred in his left lateral aspect of the neck. He gone to cauterization because for her lady love, and later he developed warts over the left lateral aspect of his face, and he is in a, what do you say, in a dilemma whether again it is to be cauterized. And the very initial presentation he came to my clinic is for depressive episodes, and all the depression, the helplessness, hopelessness, as I mentioned, no, the mind complaints and all I will be saying later. So the helplessness, hopelessness, worthlessness, these three are the important triad of depression, and this is well appreciated, and the psychiatric case taking has been done to that individual, and a few doses of natrum 0/3 along with a frequent at frequent intervals thuja also had been given. He improved enormously from his hectic condition, and also surprisingly his warts fade off from the face without any remnants. Even the markings are not seen, but the cauterization area still shows a black discoloration on the neck, where the warts which occurred on the face has not given any disfiguration to him because of natrum mure. Next slide. So endocrine system, natrum phos is for goiter, feeling pressure, natramure, hyperthyroidism, goiter I already mentioned regarding boric acid, mentioned about Addison's disease and diabetes. Natramure is a blessing for those individuals. Next slide. Hemopoietic system, natrum carb for anemia, natrum mure for anemia and chlorosis, nitricum for purpura hemorrhagica, cacodialicum for increases. Is it okay? Shall I continue? We are running out of time. Hello? Shall I continue?
Yes, sir, you can. You can.
Okay, thank you. So natrum nitricum, purpura hemorrhagica, and hemoglobinuria, anemia, such conditions will be, we should never fail to forget natrum nitricum, and cacodialicum for increase RBC to double. People will be coming and asking for, this is a remedy which promotes erythropoiesis. I am a guy who constantly believes about the Duke's exclusive criteria and inclusive criteria in our stool clause, that our medicines won't directly act as a health enhancer. But this remedy, cacodialicum, I had seen in many patients, which is had an excellent acceleration over erythropoiesis, but strictly when the symptom corresponds. Coming to the natrum marinum, chronic enlargement of glands, it is a very typical scrofulous remedy. Natrum silicicum, it is a remedy for hemophilia, both, and even for factor 8 or factor 9, it is not an issue. This remedy shall be considered. I have a patient in the US, when she got conceived in her 3rd month, suddenly her right upper arm started to swell, and it has been found that there is some issue with her factor 9 and also with labile factor, and natrum salis. She is also a girl who is living with her husband in US. Her younger childhood reveals a lot of things which drag towards natrum group. Obviously, I gave natramure at the first instance, and later the natrium silicium has been given, and now she is delivered. She is living very happily with her boy in US. Natrum taurocolicum, it is for hypoglobular. Make a pardon, it is not hypoglobular, it is hypoglobular anemia. Next slide. Cardiovascular system, okay, and the action potential we can relate here. The heart's pulsation shakes the body. Natrum nitricum, angina pectoris with pulse, slow pulse, and the angina manifests along with cyanosis. Natrum nitrosum, luckily, fortunately or unfortunately, I had never given these remedies, nitricum or nitrosum, to any angina. Okay, it is very safe to refer those individuals to the nearest emergency cardiac care, following all the critical care. Okay, anyhow, these remedies has action, or getting an acute episodes of angina. If you suspect of angina, which fades off automatically, then nitricum or natrum nitrosum shall be considered. Natrum silicium, noisy breathing with irregular pulse. Natrum iodatum with incipient endocarditis and arteriosclerosis. It can be given. Next slide. Okay, reproductive physiology, it has a very beautiful action on, for most of the female infertility cases, it requires natrum group. For vaginismus, there will be extreme dryness of the vagina, that can be, natrum group can be considered. The remedies will be natrum mure. If there is a copious secretion from the Bartholin's gland or from the labia, then the borax is the remedy. If the induration of cervix is the problem, then at auramur, natronatum is the remedy. Hypochlorosum, it is given especially for atonic state of uterine, not only for uterus but also for its ligaments, along with hepatic disorders. Okay, so natrum phos, natrum sulf for the treatment of the honey colored leukorrhea. That means the early gonorrhea, the named gonorrhea, now it has taken some other form with yellowish green. We can think of natrum sulf. Next slide. Next slide. Sterility, okay, the continuation of the same. The natrum carb, because of the discharge of mucus, borax, this remedy favors consumption, those who suffer with sterility earlier. Okay, natramure, I mentioned natrum phos with the acid secretions. Okay, next slide. Acidic secretion, because the pH level is to be maintained with the vagina. The acid base balance has to be maintained for a consumption. Not only a physical union, but also a lot of chemical unions are going to happen with the sperm and ovum. For thus conditions, natrum phos is an excellent conditions. There will be some yeast infection or some problems which can occur with the torch. That means toxoplasma, rubella, cytoplasma, and hepato. So viruses and all, we can think about natrum phos also. Coming to the musculoskeletal, it has an extra the action potential. It was well explained in the previous sessions. So that for natramur, phos, sulf, lacticum, these are the remedies given for rheumatism along with the diabetes or gout. Next slide. And natrum phos is a specific remedy for this one, hamstrings. So ankle joint, why I mentioned ankle joint separately means no other remedies has the action on ankle joint like natramur. Very few remedies comes to my mind like carbo animalis, but here our natrum carb is a very important remedy for spraining and dislocation of ankles, and natrum hypochlorosum, that is a remedy, and natrum lacticum for weak ankles, and natrum mur for paralytic weakness, natrum phos for the itching along with eczematous eruption, natrum sulf for tearing and drawing pain in the legs, especially which happens with tendo Achilles. Okay. So natrum is the remedy. Okay, I know that I was a little bit hurry in my later sessions, which I started very cool in the initial session. The time management was a little bit concern, I suppose. I know that I had not taken the cases in the format of an analysis, but definitely I'm looking forward with the team, the seminar team, to provide me a better opportunity to conduct all these case analysis in terms of repertory. I always wanted to stick with the context that it is to be understood with the physiology department and for the first year students. Okay, so and I also take this session to thank certain individuals, the Enipoya management, Enipoya principal, Dr. Winsor George. He is the main guy behind this seminar. He initiated me. Thanks. And Dr. Tom, he moderated good. So thanks for him. And also my management, White Memorial management, my principal, my staffs for supporting and encouraging me, my college chairman, I want to thank. And again, few of my friends, Dr. Job and Dr. Alisha, for letting me into this. Thank you all. Any questions you can clarify now?
Any questions? Can you please explain about the Hashimoto's thyroid case? What is the potency of prescribed?
Okay, so as I mentioned earlier, the case presentations that has to be understood to a core. The hierarchy has been built up. A lot of case sheets, case processings were there, and all those things has not. We could not. What do you say? We when in the initial of my presentation, I thought that Natram group is a big one. I have to complete it in 1 hour. I thought that it will be like dragging a cow into a dog's cage, but at the closure of the session only I understood it is dragging an elephant into a dog's cage. Anyhow, direct answer for the question is the medicine given was Natramur 30. That was the initial dose. Not only Natramur, again the medicine given was the thyroidinum 30 has been given at frequent intervals, but not at same instance. Then Tuja was also being given for as an antipsychotic. Okay, so these are the important remedies used, and I can summarize all those things with the case presentation. Okay, so if you are letting me for another session, we will do that. So the answer is Natramur 30 has been given, then thyroidinum 30 has been given, Tuja 1 has been given. These all things has been given at wide intervals at frequent assessments. Any other questions? Any other questions?
No more questions, sir. Thank you, sir. Thank you for the session.
Really, thank you, Dr. Winsor. I am very grateful for this wonderful opportunity. So hoping for another nice session. Thank you all. I am leaving.
Yeah, Riswana. I will call Riswana for the vote of thanks.
Thank you. Thank you. I'll be waiting.
I, on behalf of Enepoya Homeopathic Medical College, it's my privilege to propose the vote of thanks on this occasion. First, I thank the Almighty for keeping us all safe and letting us to be the part of this section. The webinar series like this will not happen overnight. The wheel started rolling months ago. It requires planning, bird's eye for all details. We have been fortunate to be back with a team of very motivated and dedicated colleagues under the constant guidance of our Dean. My heart feels lots of gratitude and respect for our Dean, Dr. Vivekanand Vivarnekar, Professor and HOD of Department of Pharmacy. We really owe you to, sir. A big thank to Dr. K. Maniganda Perumal, our guest of speaker, sparing his invaluable time for us by enlightening with commendable talk on this subject. Thank you, sir, for your enhancing our understanding pertaining to the Natrum Group remedies. You have indeed put best of your efforts to make this section a successful one. Special thanks to Dr. Winsor George, HOD, Department of Physiology, including Biochemistry, for being the moderator of this section, and Dr. Tom Alexander, Assistant Professor, the faculty in charge of this section, who worked a lot for to make this section a grandful one. Above and beyond, let's not forget the coordinator of this webinar series, Dr. Shilpi Rastogi, Professor and HOD of Anatomy, who worked her tail off under the guidance of Dean and given the constant support every time. Thank you, ma'am. I thank all the distinguished participants here who have attended from different destinations during this pandemic situation. Last but not the least, I thank my colleague Dr. Genu Joseph, Assistant Professor, Department of FMT, and Mr. Tamim and the Enapoya IT team who worked behind this webinar series. Once again, I thank you all. This Dr. Rizwana A signing off.
Dear participants, please fill the feedback link so that you will be provided with the e-certificate immediately. Thank you.